Okay, we're back with some more animal handling tips, and this time we're going to talk about painful or dysphoric or fractures, trauma, neck and back injuries. We're going to be talking about those type of things that may not have even triaged as stable. So what do we do with these special patients who have heightened fear? They're going to be afraid of more pain, if nothing else, and very unpredictable responses, and are fragile all at one time. We're going to look at 3 situations. All of them, I want you to realize, whenever we're not triaging stable and we're handling a patient, stress, again, has to be minimized because we've already got respiratory and cardiac systems that are under a lot of duress, and we don't need to put anything else on top of them. We're going to look at 3 situations specifically. We're going to do seizuring and dysphoric patients, we're going to do fractures, and we're going to do neck and back pain. The first one up is Atticus, and he's going to be our actor dog, acting like he's having a seizure or a dysphoric moment. Okay. And for a seizuring and dysphoric patient, strong and unpredictable movements are there. The safest hold, Atticus, would be on a table. But what you're going to see is that standard hold where you have a hold of the bottom legs and you've got your arm across the neck are going to be what you want to use. You're going to have, if you have 2 people doing this, you don't have to be laying down as so much, but you have to have that trunk covered as well. Okay? The other thing you don't want to do, though, is press so much that you've got respiratory compromise. His chest has to be able to rise and fall. We want to make sure that his head stays in this position and doesn't come down and get crunched in that position. Okay? Chest has to rise and fall, so if we do need extra pressure, we can put extra pressure. If we don't, we let him have a break on that. For handling these patients, they may bite. Okay, they don't know what they're doing, and they certainly may bite, so you have to keep your hands out of the picture. If this dog is really giving us trouble, slipping on something like this, an e-collar, so we've got a little more protection for our hands with this slipped on his head, is a perfectly acceptable way to do that, and will not interfere with his ventilation. We could use a basket muzzle. That would have less impact on ventilation, but we have to keep this airway going. That's extremely important. It will depend on what our patient looks like, what we should do there, but the thought in everybody's head should be, this patient needs to ventilate, yet I need to be safe. Okay? For a seizuring patient also, and dysphoric patients, protecting the head, the eyes from all these movements is important. Okay? A light towel, now we have this downside protected with any movements that are going on. And we also are diminishing the effects of sounds around him, lights around him, all these things that for a seizuring or dysphoric patient increase our problems. Okay? So again, I have to have room to ventilate. I have to be able to see my patient, but sometimes a light towel that can cover up and diminish some of those other things is going to be helpful in my seizuring patient. Okay? So we've protected the airway, we've protected the eyes and structures of the head. We decreased sensory input. We protected ourself. Okay? And if the seizuring patient has been going for a while, we actually want this towel to provide a little bit of elevation for the head if this has been going on for a while. Okay, back to our actor. Okay, he's done with his acting role, it appears. Let's see. Do we need anything else before? We do not have hands near the head without bite interventions in place. And do not overstimulate. And then we have to look at overheating as well. So we had ventilation, overheating. We're going to let him relax and have people off of him if we can, and just have our hands in place to hold if something else starts back up. Okay, we're going to end that as our seizuring and dysphoric patients.